Tasha Bennett, and today I'm going to walk you through an operative procedure treatment. Once you enter the room and bring your patient in, you will sit the patient down in the dental chair. Here's your headlight, here's your chair. On this side of the chair is your foot pedestal where you will let the chair back. The chair goes back like a bed to make your patient as comfortable as possible. Once you sit the patient down, you will then go over the patient's chart. Bring up the chart to let the doctor know what the patient is here for. One side you will have the patient's chart up. On the other side you will have the dental x-rays. You will go over any medical alerts that may be in the patient's chart. Therefore, when the dentist comes in, you can go over the patient's medical history. Once you have done all that, then you will go ahead and proceed to set up your room. Always wear gloves when you're about to set up the patient's room. You do not want to touch any instruments or any dental materials with your bare hand. So the first thing I want to do is open up my two different hand pieces. I have my slow hand piece, which goes on the one with the latch, and I have my high-speed hand piece, which goes on the side. Then I'm going to come over here and open up all my hand pieces. Each tray is going to consist of a syringe, two mouth mirrors, your explorer, your cotton pliers, your mixers, your condensers, your ball burnishers, and your water syringe. Once you have opened up your tray, then you can go ahead and proceed to everything else. So I'm going to go ahead and attach my water syringe to my water hose. I'm going to use my cotton pliers to go in and get out my suction. I have two different types of suction. I have my high back suction and I have my slow speed suction. Next, I'm going to go ahead and take out some 2x2 gauze. Then I'm going to go ahead and take out my cotton rolls. After I've set up everything on this side, I'm going to come over here and get out everything I need that needs to go on the doctor's side. So you're going to get all your anesthesia and your needles. You're going to have your large needle and your small needle. Once I have everything set up on the doctor's side, then you're going to go on the assistant side and proceed with the setting up. I'm going to pull out my topical anesthetic. Topical anesthetic is basically like a numbing device where a lot of doctors use on patients before administering the anesthesia. Then I'm going to come over here and pull out everything I need. So today this patient is here for 3 fillings. So we're going to go ahead and pull out our acid etch. Acid etch is like a cleaner material that cleans out any debris that's left over in the tooth after prepping with your high speed and your slow speed handpiece. Then I'm going to get out my bond and my composite. Then you also want to have our articulating paper. Articulating paper is a bite registration that we'll use later on after the doctor preps the tooth. So now I'm going to come back over onto this side and pull out the proper burrs that the doctor is going to use. Burrs is what the doctor used to prep the tooth for whatever filling. You have your high-speed burr that goes on the handpiece. The difference between the high-speed handpiece and the slow-speed handpiece is the high-speed handpiece squirts out water, your slow handpiece doesn't. The difference with those burrs is the burr that goes in this handpiece has a latch to it, and this one does not squirt out any water. And to make the handpiece work, this right here is your foot pedestal. The doctor will step on the foot pedestal to make the high speed work, also to make the slow speed work. Then you have your latch right here to turn the water on and off. After you have done setting up your room, you have your mask and your gloves and your eyewear for your doctor. You have your eyewear for your patient, your eyewear for you, and then you have your mask and your gloves over here for you. Once you're done setting up the room, then you will call the doctor. Once the doctor enters into the room, it is your job as a DA to present the patient to the doctor. The doctor comes in, you say, Dr. So-and-so, this is Jane Doe. Jane Doe's here for 3 fillings. Those are her x-rays. only medical alert Jane Doe has is asthma, hepatitis, HIV, whatever your patient has. It is your job to explain to the doctor what the patient needs. Once the doctor comes in, sets up for the patient, you may proceed on with your procedure. So you're going to glove up, mask up, and put on all your PPE that is required for this procedure. Now that I have on all my protective gear, we're going to go ahead and start working on the patient. You can come closer. We don't technically really have a real patient, so we're going to use this model, and I'm going to demonstrate to you and show you how the proper way to hold your suction. You either want to use your water syringe or one of your mouth mirrors to retract the cheek or the tongue, depending on which side the filling is on. I'm going to use my water syringe instead of the handpiece and show you how it's done. You want to get as close to the tooth as possible. That way you can capture everything that's coming out of that handpiece. Once the doctor is finished, you want to clean the tooth off and dry it off. Once this area is dry, you want to go ahead and use your acid etch. Place it on the tooth. Your acid etch sits on the tooth for a minimum of 15 seconds. Once the acid etch is placed on the tooth and you've counted up to 15 seconds, you would then proceed to go ahead and rinse the tooth off. You want to rinse it really good and dry it really good to make sure that there's no etching left on the tooth. Once you dry the tooth off, you want to go ahead and get your brush. You want to dip it in your bond, place the bond on the tooth. You want to air dry your bond. Then you proceed to using the curing light. The curing light is a UV light that will dry and harden up the material. Once you place your bond on the tooth, you will use the curing light. Place it on there for about 10 seconds. The light is very strong, so please do not look at the light. Once you cure the bond, you will go ahead and proceed with your composite. And your composite material is basically an adhesive that the doctor will use in the area that he prepped for the tooth. So the doctor will place the composite on the tooth. You would then go to your tray and look for either your ball burnisher or your condenser. These two instruments are used to pack the material and smooth the material out. Or you can also use the football burnisher as well. Once the doctor has finished doing that, you will then proceed again with your curing light. This time with the curing light, you will cure it for 20 seconds. After you cure the composite for 20 seconds, then you will have your patient bite down on your articulating paper, also known as the bite registration. This paper is red and blue. It will leave marks on the patient's tooth if the filling is high. After you are done with your filling and the patient says they're okay, then you will proceed to go ahead and clean up the room. You will put all instruments back on the tray. You will place any needles, used needles, in your biohazard bag container. Any cotton rolls or 2x2 that has any blood-borne pathogens on it, you will dispose of it in your biohazard trash bag right here. So we will go ahead and clean up, put everything away. You will place all instruments on tray, anything that's used and not used. Take everything up and dispose of anything that is left over. I hope you found this video very informational, and I hope you have a good day. Thanks for watching.